Hi everyone. Now we're going to be taking a look at the tibiofemoral joint, or the knee joint, given its name, of course, as you now know, by the two bones, the tibia and the femur. The tibiofemoral joint is a fairly typical, as I've mentioned before, hinge joint, and that means it moves essentially in one plane, flexion and extension. It does have a little bit of rotation, but typically we just describe this as a hinge joint. What we have in this synovial joint, as I've shown you before, are some ligaments which reinforce it. The lateral collateral ligament. On this model, it's cut away. This is the medial collateral ligament. Then we have, if I pull away the patella for a second, inside there's one of the cruciate ligaments. This is the anterior cruciate ligament. And then on the back we can see the posterior cruciate ligament. There are also fibrocartilage discs, essentially called meniscus. Lateral meniscus deepens the socket. This is the most unstable joint in the body, so it really requires a lot more stability. Medial meniscus, medial and lateral meniscus. Common injuries that occur at this joint are tearing the medial collateral ligament, tearing the medial meniscus, and the anterior cruciate ligament is also not an uncommon injury. We can see, of course, the patella here, and this forms, as I've mentioned before, the patellofemoral joint, where the patella just rides up and down in the groove at the end of the femur. This is not a true synovial joint. It doesn't have a synovial joint capsule, no synovial fluid, but certainly can be a source of problems. We'll talk about that in the patellofemoral joint. Most knees have about 140 degrees of flexion and full extension to 0, but a lot of people will have hyperextension of the knee. That's a very common thing that you see, in particular with females more than males. Okay, on to the foot and ankle.